All right, let's open it up for questions for really the four presenters, the past two presentations. I think we have a few minutes for a couple questions. I'll get us started. So, being like the healthcare person, right, that's working in the hospital and trying to get some of these interventions, I'll say a big barrier is who the hospitals let in and don't let in, right? And so I was wondering how you all dealt with that in terms of being considered appropriate, accredited, certified, whatever the adjective is, organization, to which we can refer our patients and then receive services. And are those services received during the hospital stay, in the hospital walls, versus outside of the hospital in some telehealth outpatient capacity, and how you all navigated that?
Yeah. And Hard Beauty, you guys should come up. The piece I was going to say is we're embedded in a healthcare system, right? And for us, we really believe that doula work, recovery coach, peer support services need to sit in different ways, right? There's no wrong or right way for us to all exist. We do believe, and our program has really believed in intertwining our program within the hospital system for recognition and for ease for our patients. We've had some battles, right? Like in Britain, I always talk about, we've had situations like, we're not letting you in because you're too many support people. And so then we say, she's an employee. She works here. She has a badge. I'm like, you just walk in. So there's those little logistics that happen. But I would say our goal in our program is really how do we integrate our program, embed it in so that those seamless referrals can happen. Because, what we believe is there are people who don't know they need the services until they sit in the healthcare system. There's people who know they need the system or need the support, and they can get community to support them. And so we really believe in the system approach for our program. I'll let you.
It's a little different for us. So I got to tour, I've toured 17 hospitals in the state of Colorado, and I've been all over the state. So visiting, it looks really different here in Denver. We've got a beautiful university hospital and all of this stuff. But like if you go to a rural community like Lincoln Hospital, there's no maternity wing. There's not any of that. And so just to be able to respond, my first call at Children's Hospital, I don't have to be a credentialed person to meet someone in the lobby. If someone knows I'm coming, I'm Raquel Garcia, a recovery coach, and I just want to talk to you. I don't have to be credentialed. As long as that person lets me in their room, that's how we did it when we did Daisy, I'm coming in. And we actually were able to remove everybody else that wasn't allowed in that room. And so it looks a little different. With some of the hospitals, we are contracted. Denver Health, we have a contract, so I can go in. But it's not always easy, because guess what? Not everybody in the hospital knows we're there. They don't know who we are. They don't know what we do. So it has been challenging, but waiting for the processes of hospitals to occur, people will die. Being very candid. Some things take a year, and I don't have a year. I don't have a year for a mom to get help, and I'm not gonna wait, so we don't. And so we have some contracted facilities. Those that are not, while they're waiting for the powers that be to get through all the things they have to, we decided to create another link. So we have one link that is connected to the hospitals that we have contracts with. We have another link that, like Allison at Lutheran, literally, this is how we met. She texts me, "Hey, bestie." I'm like, "Hey, girl, what's up?" She's like, "I got somebody." I'm like, "Sweet, here's a link." And I don't have time for the system to get through it. She sends me the person. It has an ROI on it. So one of them, like within a hospital, is not going to have to worry about the ROI, release of information. But the link where I do have a release of information on that is taken care of so that I can come in. While we wait for the powers that be to finish their contract processes, again, 12 to 16 months is just unbelievable to get care. So we found a workaround. And so we respond until the system catches up. We're still responding.
I was just going to add, I was just going to add really quick, the work that we do is relationally driven. And so I think fortunately for us, the relationships that you were able to build through Moms Plus and CPCQC really gave us the inroads into some of the facilities that we serve in. Different medical systems have greater ease than others. And so like exactly like you said, until the systems, until the hospitals become wise to what it is that we're doing, sometimes they might require a different pathway. I know certain facilities, we're now in the process of getting contracted and getting MSAs in place, and they are requiring that we come on as a vendor. But it's really just facility dependent is what we found.
Questions?
It's actually not a question, but I just wanted to thank y'all for coming up and telling your stories. I know y'all are professionals, but I'm sure it's still really difficult to get up in front of a room of strangers. So just like a huge thank you. I think people really connect to personal stories. So a huge thank you to those who shared your lived experience today.
That was the perfect way to conclude this part of the afternoon. So thank you. Thank you so much. All right, we're going to move on to our next sharing of resource. We have Joan Holtz, who's the Director of Family Support at Illuminate Colorado, will provide a program overview. Here you go. You're welcome.
Well, good afternoon, everyone. Thank you for having us here. We are with Circle of Parents, so I'm going to talk a little bit about what Circle of Parents is and what we do. So we'll get started. If I knew how to move this, there we go. Never mind. I got it. It's all good. Technology is everywhere. All right. So first I'm going to go into like what is Circle of Parents, and then I'll talk a little bit about a couple of stories I'd like to share. So Circle of Parents is a peer support program designed for parents and caregivers. Its mission is to prevent child maltreatment and strengthen families through mutual self-help parent support groups. It provides a friendly, supportive environment led by parents and other caregivers. It's a space where anyone in a parenting role can openly discuss the successes and challenges of raising children. It's a space where they can find and share support. So Circle of Parents is a national program, and it is an evidence-informed program, and Illuminate is the lead for the state of Colorado, or the lead implementation. And what we do is we provide all the technical support for our Circle of Parents across the state. We have over 51 groups across the state, and those groups can be anything from a recovery group, Circle of Parents in Recovery, which we're going to talk about some more, but we also have groups that are kinship, foster care. We have a couple of groups that identify as parents whose children have special needs. We have Spanish-speaking groups, so we have many different types of groups all across the state of Colorado. So with this, we have an opportunity to really reach parents in different places from different needs within their communities. So the foundations of the model, it is a nationally recognized model. The Circle of Parents peer support group addresses all 5 of the strengthening families protective factors by promoting healthy social connections for parents and improving parental resiliency. It is strengths-based. It focuses on parent leadership. It is free all the time. Most of our groups are weekly, but it can be bi-weekly or monthly, depending what the needs are of the community. It is parent-led, and it is professionally facilitated. It's trauma-informed, and it's sharing, learning, support, and friendship. And then we also have a children's circle component. So the model foundations, it's mutual self-help, it's shared leadership and ownership. It is a family support program, and it drives with all the protective factors. And we know the protective factors are concrete support, knowledge of parenting and child development, social emotional competence of children, social connections, and parental resilience. But what I want to talk about today is how we know that Circle of Parents is really helping and supporting families within our communities. We have in Jefferson County, we have a Jeffco Recovery Night, which is a recovery group. And this group meets weekly. And this group has been going on for 5 to 7 years. And during COVID, of course, they went to Zoom, and now they're back live. And one of the things we found is that some of our parents have said that in this group, this is where they're sustaining their recovery. Everyone who's in that group has some sort of connection to recovery, child welfare. And so they come together, they have an opportunity to support each other, speak with each other, be honest with each other, because these spaces are non-judgmental, they're confidential. It's not a curriculum-based program, so parents can come, they can stay for as long as they want. We have some parents that come for up to 5 years, longer. Some parents come in, they leave, they come back, depending on where they are within their recovery journey. So we have one parent who's been in one of our groups. She's been there for 5+ years, and she said, I've brought brochures. She said that circle of parents has saved her life. It has given her places where she knew she was so close to thinking, oh, what am I going to do? Do I need to come? Am I going to reach back and taking drugs, or am I going to come to this group? And am I going to be there for my kiddo? And she stayed. She has been in recovery for 5 years, and she's brought her kiddo in. And what she likes to say is this group has saved her life, and her kiddo has been raised within this group with all the other parents. So we see that there's also a child resiliency factor along with the parent resiliency. One of our other pieces that I want to bring up is we have a facilitator. So it's not just support for the parents, it's also support for the facilitators. We've had a facilitator who's been through a very rough time recently. Her daughter has passed, and she went to her group and asked her group for support. And she has said through this whole part of it, I would not have made it if I had not had this group to help me in our support. So it really is those social connections, being together, being able to talk to each other, having that safe space, enjoying that time. They do fun things too. So it's really all those different kinds of ways in which they come together. This particular group, they have food, they have childcare. It's really a part of where they can come in and really spend time together eating and then participating in their circle of parents group. And this is how they really are helping themselves become more resilient. So I'll end kind of here, but I have brochures. There's more information. There's more little pieces to it, but we are here to support. If you're interested, you can reach out to either one of us. We will give you that TA. We'll help you walk through the process. And I forgot to mention that Britt does have a circle of parents group. So we love that Britt is doing that, and so appreciate the work that she is doing, because she's been doing that for a while for us. And I know she's reached into that support group and how imperative parent support groups are for parents. So thank you so much. And there.
Thank you so much. All right, we're going to take a 10-minute break. We'll return at 2:45 for our concluding keynote.